Welcome to this episode of Little Bits of Stuff with Dr. Nick. On this episode, we'll be discussing the effect of sugar on the severity of menstrual cramps. With me here today is my co-host, Dr. Linda. Linda, say hi.
Hi.
Oh, okay. Well, I was expecting you to say hi, everyone.
Sorry.
Yeah, so Linda is a doctor, works with University College Hospital, Ibadan, Nigeria. And did you know that painful periods, or dysmenorrhea, as we call it in the medical world, is the most commonly reported menstrual disorder? Now, there are two types: primary dysmenorrhea, what most people experience as painful or menstrual cramps, and then there's a secondary dysmenorrhea. Menstrual cramps is usually caused by prostaglandins, a substance made in the lining of the uterus. Pain usually starts either right before their period or on day one of the period, and for some other people, they usually do have pain on other days. Pain becomes less as the day goes by for some people, and this is because of a decrease in prostaglandins. When does this pain start? For some people, it starts when they begin their periods, and for some people, it starts when they become teenagers. I don't know when did it start for you, Linda?
You mean cramps?
Yeah, your menstrual cramps.
It starts 3 days before my menstrual period.
Okay.
Around that. 2 to 3 days.
3 days before your menstrual period?
Yes.
Okay.
That's when I, get the pain.
Okay. How bad is it on day one compared to other days?
I think it's worse on day 1 and day 2, then it subsides around day 3.
And you don't have any pain going forward?
No, just day 1, day 2.
All right. Okay, so when did it start initially? When you had your first menstrual period, or you had become a teenager, or it was in your 20s? When did it start actually? Exactly.
Well, I can't remember.
Well, would you like to hazard a guess?
Wait, you mean my first period, right?
Yeah, your first menstrual cramps you had.
Oh, my first menstrual cramps. Okay, it started. I think I felt the pain on my first period.
Oh, okay.
Yeah.
And how about the next month and the other months? Were you having this pain consistently?
Having the pain. I have the pain, consistently.
Oh, okay.
But not as painful as probably the first time.
So how would you compare the pains you have now? Do you still have the pains?
Yeah.
How would you compare the pains you have now with the pains you had when you first started out?
Well, I feel it's better now.
Oh, you feel it's better now?
Yes.
Oh, okay.
Because maybe I'm able to withhold it.
Oh, okay. Would it be right to say you're used to it?
Yes, probably.
Okay, so some say as you get old, the pain decreases, and some even say when you give birth to your first child or second child, or when you just start giving birth, the pain decreases. I don't know. Are you married, Linda?
No.
Okay, so secondary dysmenorrhea, on the other hand, usually is caused by something like a disease process. Common causes what we refer to as endometriosis, fibroids, adenomyosis, and other causes. Endometriosis occurs when the lining of the uterus is growing outside the uterus, and this can grow in the ovaries, the fallopian tubes, your bladder, and other several organs. So it will bleed in response to hormones, just like the uterus, and the blood can cause irritation and then pain. Other times it can leave what we call a scar tissue, which can also cause pain after the menstrual cycle. Adenomyosis occurs when the lining of the uterus is now in the muzzle of the uterus. There are several types, but this is just how I can break it down. The uterus has a lining, the muzzle, and an outer covering known as the serosa. In order for your gynecologist to determine if your menstrual pain is primary or secondary, they will need to take a history from you, including your menstrual history. This can also be done via some Android apps or iOS apps, which helps to record your flow as the months go by. I think usually at about six months or so, most apps will be able to inform you and give you accurate information about your menstrual flow. Do you use an app, Linda?
Yes.
Which one do you use?
Um, my tracker.
My Tracker.
That's what it's called.
Oh, okay. It's an Android app, right?
Yeah.
Would you recommend this app to anyone?
Well, yes. Yeah.
Okay.
I don't use it all the time though.
Okay.
But I just installed it once and it has been on my phone.
Oh, okay. So does it have reminders? Does it remind you to keep track of your period and how you feel?
Yeah.
Okay.
Well, it's good for people that are forgetful.
Oh, okay. So are you trying to tell me you're forgetful?
Sometimes.
Okay. So how accurate is it in telling you when your next period will be, your fertile period, and ovulation and things like that?
Well, it's pretty accurate. Like you said, like if you've used it for like 6 months.
Okay.
So it's like
it gets more accurate the more you use it.
Yes. It might be a day late, 2 days late, but at least it's pretty accurate.
Oh, okay. There's this other app on iOS. I think the Flow app, they call it the Flow app. It's also a very good one, just in case you use an iPhone. I actually do encourage most ladies to use an app, because when you come to the clinic and you want to tell your gynecologist about how your menstrual period or your menstrual flow has been, an app easily just helps you to say everything you need to say and answer these questions correctly and accurately. Most of the time, I just snatch their phones and then just go through the app myself, and I'm able to answer questions based on what I've found on the app. So it's pretty much useful. So apart from all this, a pelvic exam will also be done, and also you have an ultrasound scan done. Your treatment will depend on your diagnosis, primary or secondary dysmenorrhea, as we have discussed earlier. If primary, treatment is usually stepwise. We use some sort of drugs. We call them non-steroidal anti-inflammatory drugs, such as ibuprofen, naproxen, and a host of all others. They counteract prostaglandins, and it's advisable to use them the very first start of pain, or the very first drop of blood, which most people do actually notice. If you have reasons why you should not use NSAIDs, what we call contraindications, for example, people who have asthma, you can talk to your doctor about alternatives. There are also other medications like combination contraceptives. These contain estrogens and progesterone. For example, the birth control pills that you use, and other implants like Implanon, Depo-Provera injection, and the rest. There are some sources that have said vitamin B and magnesium are helpful in controlling menstrual cramps. However, there's not been enough research to actually recommend them. Some people have also explored acupuncture, which is not too common in our environment. Have you had an acupuncture before, Linda?
No.
Would you love to have one? Have some needles and all that? Okay, so now on to the big question of the day. How does sugar affect the severity of menstrual cramps? Does sugar have any effect on the severity of menstrual cramps? We've had this debate for over a decade, and personally, I do not. Well, maybe before I air my own opinion. Maybe Linda has some gist for us about sugar and menstrual cramps. What do you think, Linda? Do you think sugar really affects the severity of menstrual cramps?
Yes. Well, from experiences and friends' experiences, I would say yes. But
Okay.
before we get into that, there's something I read
Okay.
that about sugar and its relation with menstrual cramps.
Okay.
So it's like sugar consumption is directly linked with our hormone levels, right?
Yeah.
So insulin, for example, processes glucose that comes from sugars and carbohydrates. So too much glucose can affect the hormones that control your insulin levels, thereby skyrocketing your reproductive hormones like estrogen, which makes your symptoms worsen.
Okay.
So for experiences now, like I have friends that say when they take soda or take sweets, chocolate, pastries, their period cramps gets worse. So they avoid this during their periods.
Their periods, yeah.
Yeah. But for me, I don't really get any effect.
Oh, okay.
I
You were
tend to
actually telling me
crave-
before the show that you do actually crave for these
Yes, I crave
things
for
rather
sweet
than
things rather than avoid them.
yeah.
So-
But what you just told us about the insulin, the reproductive hormones, and the rest, has that been confirmed as a link between menstrual cramps and sugar, or it's just some hypothesis you read somewhere?
Hypothesis.
Oh, it's mainly just an hypothesis.
Yeah.
Oh, okay. So, do you know about other dietary products or part of our nutrition that can affect the severity of menstrual cramps?
Well, yeah, caffeine.
Okay.
Yeah, that's like it's. Oh, I read somewhere else that it causes tension and causes blood vessels to constrict, which makes cramps worsen. I heard
Okay.
that. Yeah, then I think I've heard salt, alcohol.
Yeah.
That well, I don't really know the relations, but they're like these are foods women should avoid
On a
on-
very good day. Is it before their period
no, during their periods.
or during their periods?
Before or during? Before like 2 days.
Yeah, but most
obviously.
ladies have their periods before. I mean, have this pain at the start of their periods, or some even have it like 2 days or so
Really,
before their
yeah.
periods. What would you say is the most common one? Before the period, or during the
I
period,
feel
or at
before.
at the start of the period?
Well, before to the beginning of the start of the period. So like it's like a warning sign. So when we get that pain, we're like, oh, my period is on the way. I think it's my period that is about to come.
Oh, okay.
So I feel before.
So even before that very drop of blood,
Yes.
you have this
Warning pain sign.
Okay. So I've been searching on the net for almost a week now, and for the life of me can't find any research or anybody at all talking about the a relationship between sugar, eating a lot of sweet snacks and the likes before a period, to the severity of the period. There are researches pointing to the fact that a lot of ladies actually say sugar increases the severity of the period, and there's so many researches that have been done that actually have collated data reporting these incidences. And I've also had personal experiences in the clinic, and friends alike, sharing their experiences with me, telling me about the fact that once they take a lot of Fanta, for example, before their period, or they take cake, there are some other drinks or other foods. Linda, can you help me out here?
Beverages.
Oh, beverages, yeah.
Beans. Like I have a friend that avoids beans when she's on her period because she says it worsens her cramps.
Oh, okay, that's a new one.
Even pizza. That's so weird.
Pizza, for
Yes,
God's sake.
like I was happy when I was with her because I got to take the pizza. So
Oh, okay. So that's a
Yeah,
good one for you.
that's a new.
I
Yeah.
guess you could be buying pizza anytime she's on her period. Yeah. So I don't know. I don't know. At some point, I felt it was maybe psychological. You know, most ladies, while growing up, I'm sure it happened to you too, Linda. You hear your senior um, colleagues or your senior ones telling you about the fact that you should not take a lot of sugar when your period is approaching because you may have more pains than usual and all that. So it's already embedded in you that you would have more pains when you have sugar before your period. And so, how are we so sure that it's not just the psychology, playing us, playing games with us, and not the fact that there's really any relationship between sugar and severity of menstrual cramps? How are we so sure, Linda? I'm sure you were told this when you were growing up, even before you started your menstrual cramps.
Honestly, no.
Okay. But there are so many, but there are so many rumors flying around about things like that. I'm sure if you pick a kid from the street right now, she would tell you that, oh, okay, sugar causes a more severe menstrual cramp. So I don't know. She has already heard this story, so she's already conditioning herself to avoiding sugar when her period is approaching. And so when she does that, because there are people out there who also don't it doesn't matter whether they take the sugar or not, they still have their menstrual cramps as severe as usual. And sugar or not, it's affects their activities of daily living. So it's really not something that we can really put our foot out for. That for real, it's a real thing. I don't believe right now that it's a real thing. I still think maybe it's some psychology or mind game, maybe that stems from Adam and Eve, or maybe from Eve herself. Yeah, so I'm yet to see any research. For listeners out there, if you have any research that links sugar, intake of sugar or sweet dietary products with an increase in the severity of menstrual cramps, I do think you can send it to me, and then we'll dissect it, and then take another look at it. So moving forward, how have you been coping with your menstrual cramps, Linda?
Well, I'm able to reduce the pain.
Okay, so you just bear the pain. You don't use any drugs.
No.
Okay. Have you ever had any cause to use a pill?
Yes, I think yes, once or twice, when I couldn't bear the pain, so I made use of a medication.
Okay. So what common medications have you used that worked for you? Okay, ibuprofen.
That's like the most common one.
Okay. I
know of the most common one I know of. Like I and my friends make use of.
Yeah.
So.
Oh, okay. So I think there's this other common drug, Felvin, they call it. You've never heard of Felvin?
No.
Oh well, Felvin is, I think it contains piroxicam, if I'm right. That's a common drug that most ladies out there can relate with, that I know, that I've met anyway. Yeah, but some people do take diclofenac, some take ibuprofen, some even go higher, to take several kinds, of medications. I don't know if some people get high just to kill menstrual cramps. It's possible. Don't look at me like that. It's possible. It's possible. They may be getting high on something.
On what?
I don't know. There's so many drugs of abuse out there.
Oh yeah, I've not seen one.
Oh, okay.
I've not,
yeah, well,
yes.
who knows? Maybe we may meet someone some other time that would tell us maybe she drinks or takes or smokes a cigarette, or something, just
I think
something.
the other ways people could relieve pain,
Yeah.
like we can make use of this hot bag. I don't know if you've heard of that before.
Yeah,
Yes.
I've heard of that before.
Yeah, you could either use that, or my friend, then we have this gas heater in the room.
Okay.
So what she does is that she sits on top of the gas heater, or like she lies very close to it
Yeah.
for the heat, because the heat helps with it. Even drinking hot tea also helps with that too as well.
Oh, okay. So that's some of the ways some have actually coped
to relieve
with
the
this.
pain, apart from using medications.
Yeah.
Yes.
Oh, okay.
Or you sit in the bathtub of hot water.
Yeah.
And just like pour down.
Oh, sits in the bathtub.
Yes.
Okay. Well,
inside hot water.
Any other thing you can think of?
No.
Oh, okay. So, the advice for ladies out there who have debilitating menstrual cramps that reduce your activities of daily living. I've heard of situations where, well, not just had, even seen situations where ladies can, even roll on the floor, hold their tummies tight, and not even be able to respond to your call.
Yes.
Yeah, you see cases like that, right?
Yes.
Yeah, and no matter what you do at that point in time, you just have to give them some form of analgesic, in form of injections and all that to get them to calm down. And it goes on and on and on.
Sometimes, these medications don't actually even produce a very good effect.
Oh, really?
Yes.
Okay, so the times you've used ibuprofen, you had no really good relief?
Yeah. Okay. Like we were having an exam that day, so she was in this severe menstrual pain, and then she used medications, but the thing didn't calm down the pain. We had to call 112, like emergency, for her around 3 a.m.
Oh wow.
So they had to give her, they injected her.
Okay.
I can't remember the medication they gave her.
Was she on admission for that?
No, they just came in and gave her the injection. Within 10 minutes, she was okay.
She was okay?
Yes.
Oh, okay. And did she have other episodes after that?
No, that was it for the month.
Oh, okay. Yeah, so what's your advice for, or what would you say is your conclusion? Let's start with that, for the relationship between sugar and menstrual cramps, the severity of menstrual cramps.
Well, I feel if you've taken any sweet thing during period and you see it worsen your cramps, just avoid it. That's it. I mean, just avoid it. Then it will pass, like 7 days, 6 days.
Yeah.
Then your bag, you can take any kind of sweet you want.
Okay.
So I think you should just avoid it.
Okay. That's it from Linda. And my take on this is, if you're having menstrual cramps that is severe enough to disturb your activities of daily living, you should visit your gynecologist and have a pelvic examination and have him check you out. You may be having some other condition that may warrant some other form of treatment, that may even go as far as having surgery to treat your menstrual cramps. And that's it for this episode of Little Bits of Stuff with Nick. It's bye for now. And Linda?
Okay, thank you very much, Nick, for inviting me, and thanks to everyone who is listening.
Okay, so
bye.
Bye. So do
bye.
follow us on Instagram at Little Bits of Stuff with Nick, and on Twitter at Lil Bit of Stuff with Nick, as in LIL Bits of Stuff with Nick. We're also on iTunes and Google Podcasts. Please do well to subscribe. If you're on Audio Mac and Stitcher, we're also there. So Till we meet on the next episode. So bye.